Today I'm going to be answering the question, what is pelvic floor dysfunction? A couple Fridays ago, just to recap, we talked about what the pelvic floor is and that there are three layers. One is a superficial external layer, another one is a deeper layer of muscles, and third is, it's actually the second layer of your pelvic floor is an intermediate layer that surrounds your urethra and is between both two layers here. There are two main types of pelvic floor dysfunction. This includes underactive, or what's called often hypotonic pelvic floor dysfunction. And on the other end of the spectrum, we have overactive pelvic floor dysfunction, or what's often called hypertonic pelvic floor dysfunction. So just to note, you can have a mix of both types of pelvic floor dysfunction. You may fall somewhere over here or somewhere over here. You may have pelvic floor dysfunction in one area of your pelvic floor. Maybe the rest of your pelvic floor is functioning well. Because everything's connected, there may be a time when both areas become affected. It just depends. So that is why it's very important to see a pelvic floor therapist to assess these muscles and actually see where they need to treat and how it's best to treat them for you. I like to use my arm as an example of how the pelvic floor functions, okay? So, and that's simply because it's simple, and also your bicep is skeletal muscle, just like your pelvic floor is made of skeletal muscle. And those muscles need to be able to contract fully to generate strength to support and help coordinate, as well as need to be able to lengthen and relax all the way through a full range of motion. So if there's any issue with how the muscles contracting or relaxing and coordinating with other muscles, we call that pelvic floor dysfunction. So some symptoms of pelvic floor dysfunction, there is a lot. Anything that is happening with your bowels, your bladder, going to the bathroom, any sort of issue with sexual function, those all can be caused by your pelvic floor muscles. Remember, your pelvic organs run through your pelvic floor. So if there's an issue with symptoms, your pelvic floor muscles could be a cause. They could be the main cause. They could be one contributor to the symptoms you're experiencing, and you may have other reasons as well for those symptoms you're experiencing. If you are having what we often call more orthopedic pain, like sacroiliac joint, tailbone pain, low back pain, hip pain, I would definitely get your pelvic floor assessed by a pelvic floor therapist, because that could be the missing piece to your symptoms, especially if you're not getting better. And as far as the tailbone goes, your pelvic floor muscles attach there. So if you're having tailbone pain, if you've fallen on your pelvis and it just isn't getting better, it doesn't feel right, get your pelvic floor checked. It makes the most sense. That's where your muscles attach. So if there's an issue there more than likely is an issue with your pelvic floor. You don't know until you get checked. As far as specific symptoms that are associated with one type of pelvic floor dysfunction or the next, some of them we see with both. We can see leakage, some incontinence with both, because you can't manage pressures well if your pelvic floor is also clenched. You can't really manage the pressures well. So you still might leak urine. That pressure above may force that sphincter that's closed open when you don't want it to. Leaking can happen with both. It's more often associated with underactive pelvic floor dysfunction. So that would mean that you're not necessarily generating the strength, or maybe you don't have the correct timing for that contraction to happen, or that coordination of that contraction to happen. So in that case, that the urinary or anal sphincters may not be closing in time to support, again, the pressure from above. And that could cause episodes of incontinence or leaking. You may also see heaviness in the pelvis. that often can be associated with underactive pelvic floor muscle dysfunction because you're not getting that support of those pelvic organs. Maybe you have a pelvic organ prolapse as well, and that could be giving you those symptoms of heaviness in your pelvis. So those muscles need to be stronger to support those organs better. For overactive, we see, again, a pelvic floor that has difficulty relaxing. So those sphincters aren't going to open well, and we may see symptoms like chronic constipation, pain with bowel movement, pain with urination, UTI-like symptoms like frequency, urgency, hesitancy, difficulty starting a urine stream. Maybe it takes a while to relax those muscles and you're just trying to urinate. We can also see pain. Pelvic pain is huge. Pain referring to, again, hips, lower abdomen, back, but with this contracted muscle, we can also see irritation of those nerves and compression of those nerves that run through those muscles and that innervate those muscles. When that happens, there could be pain or symptoms of even itchiness, burning in the pathway of those muscles to the genitals. There could be, again, these muscles have different referral patterns that can refer to pelvic organs. And, you know, your sphincters are supposed to be able to relax. If they can't relax, this is urinary sphincter as well, it's going to irritate the urethra. So often we'll see people who feel like they have a UTI and there may not be an infection present, and feels just like a UTI, but it's really their pelvic floor muscles that surround the vagina, the urethra, are overactive, and it's causing irritation of those nerves and around the organ itself. In regards to sexual function, if there is pain with intercourse, pain with orgasm, if that might be associated more with an overactive muscle dysfunction, if there is a lack of ability to orgasm, maybe it's taking longer to climax, it's more difficult to climax, that also can be due to more an underactive pelvic floor dysfunction issue. So those are the two dysfunctions. If you have any questions about pelvic floor dysfunction, please DM SoulSource. You can leave a question or a comment below and I'll make sure to answer it, or you can always reach me by email at askapt@soulsource.com.